So at birth, you need to assess colour, tone, breathing and heart rate. An easy way to remember this is can't take baby home. So during the first 60 seconds, you're drying thoroughly if it's a term baby, changing the wet towel and looking at the baby's colour, tone, breathing and heart rate. So for colour, we're looking for central perfusion. So we look at the mucous membranes, and what we don't want to see is central cyanosis. The hands and feet of the baby will be bluer, and that lasts for about 48 hours after birth. The baby will prioritise blood to its brain and its heart and away from the peripheries, so that's why we need to look centrally for good perfusion. In terms of tone, we want to see that the baby can flex all its limbs. If we see a floppy baby, then we would be concerned. In terms of breathing, we're looking at chest rise and adequate breathing. So a normal breathing rate for a baby is between 40 and 60 per minute. If we hear a baby making a noise with each breath, we call this grunting, and this would be a sign that the baby is probably too cold and needs respiratory support. The airways should be opened and the baby should be warmed up as much as possible. To assess the heart rate, use a stethoscope in the middle of the chest and listen for heart sounds. From a human factors point of view, what neonatal teams and midwifery teams in hospitals do is tap out the heart rate. Then everyone in the room knows what the heart rate is.